Before we start talking about COVID and the return to work services, the pandemic has made it a good time for us to pause for a moment. This to reflect on our use of technology, modern convenience, and the human factor. For me, the sweet corn season isn't nearly long enough. There's nothing better than hot corn on the cob drenched in butter. And like you, I have a standard kitchen including sink, stove, microwave oven, refrigerator, etc. that I've had for many years. To prepare the corn, I would put a pot of water on the stove at high heat. While the water was heating, I would remove the corn husk and do the tedious task of removing the silks from the corn cob. And once the water was boiling, to throw the corn in for 10 minutes. After the corn was cooked, to move the pot of water to a cold burner and put the corn on a plate of paper toweling so that excess water would be soaked up. I never dumped the pot of hot water into the sink after once learning that the steam burned your hands. Today, can we stop this for a second? Hello? I can't hear you. Oops.
You hear me?
Yep.
Okay.
All right. There's just a slight difference that I need to fix here on this script.
Okay.
And because I was using a paper version, I quickly scratched it in yesterday. Are my eyes looking okay as I'm looking at the screen?
Yeah. Okay.
Okay. As long as it's not looking wonky.
Mic check, mic check. Can you hear me now?
Yep, I can hear you.
Okay, good.
What did you do?
I changed my mic, which I didn't know I had two mics. Apparently I do.
Yeah, I think that you
All right. All right, let's see here. Am I still sharing?
I still see you, yes.
Okay. I'll put that back up. All right, I think we can get this thing going again.
Okay, I'm gonna shut off my video and mute. If you start talking and have any questions, I will unmute myself.
Okay. Before we get started talking about COVID and return to work services, the pandemic has made it a good time for us to pause for a moment. This to reflect on our use of technology, modern convenience, and the human factor. For me, the sweet corn season isn't nearly long enough. There isn't anything better than hot corn on the cob drenched in butter. And like you, I have a standard kitchen, including stove, sink, microwave oven, refrigerator, etc., that I've had for many years. To prepare the corn, I would put a pot of water on the stove at high heat. While the water was heating, I would remove the corn husk and do the tedious task of removing any silk left on the cob. And once the water was boiling, to throw the corn in for 10 minutes. After the corn was cooked, to remove it and place it on the paper toweling so the water would soak up any excess water. Now, I never dumped out the pot of hot water after once learning that when you did this, the steam would burn your hands. More recently, I re-looked at my kitchen. Now I throw 2 ears of corn, husk and all, into the microwave for 6 minutes. When cooked, I pull out the ears and cut off the bottom of the cob. I then grab the cob by the silky area on the top and shake the cob up and down 5 or 6 times until the cob slides out of the husk silk-free. So, less mess, no waste of water, and I don't have to find room for the pot in the dishwasher. With respect to the human factor, my mother lives 13 hours away and is in a retirement home. She's a bright woman who taught nursing for many years and authored several nursing textbooks. If you RNs kept any of your nursing textbooks, you might recognize Saunders and Elsevier Publishing. Mom, like every 4 out of 5 people, is right-handed has a bilateral hearing loss, left, worse than right, and her eyesight is failing. Whenever my mother calls or I call her, I know when her muscle memory has unconsciously kicked in. I know this when she has problems hearing what I say. Since then, I've learned to tell her to switch the phone to her right ear. By the way, which ear do you usually place your phone to when you receive or make a call? Think about it. And lastly, with respect to technology, sometimes the best laid plans don't work as you expect. Again, back to my mom, who has always been a prolific reader of books, newspapers, and magazines, and then giving them away to others so that they too might enjoy them. I mentioned mom's failing eyesight before. Her eyes are what they are, and a change of prescription won't make any difference. Unfortunately, due to this, she can't read anymore, which has affected her quality of life. So, what to do about this? The idea came up about using an iPad with audiobooks installed for her to listen to the content rather than read about it. It was decided to use headphones rather than earbuds, as they would not interfere with her hearing aids. Plus, I created a step-by-step instruction that included pictures on how to use the iPad and access the audiobooks. A copy of the instructions were made for her and one for the nurse's station, so staff could assist mom as needed. I thought this was pretty clever, if I do say so myself. I brought everything to her in August, and it got passed to her through closed doors of the nursing home. Closed doors because COVID-related rules of no family or friend visitations in or outside of the facility. So we talked to each other by cell phone, looking through the glass doors. The nursing assistant who was there said she would bring the instructions to the nurse's station and let staff know about it if mom needed any assistance. I went home the next day. Mom has never used her iPad, as she can't figure out how to use it. The nursing staff was reduced from the facility due to COVID, and folks are subsequently busier. I've made calls to the nurse's station, and they say that they'll work with her, but that hasn't happened. So mom says that she'll wait until the COVID restrictions are off, and I can come out and visit. Maybe there's another way to approach the problem, so I'm still thinking about that. Quite frankly, everyone has to be more creative, both for ourselves and for the people we serve. Maybe it's helping clients learn to better work their cell phones to enhance distance meetings and medical appointments. Something like using the phone speaker function or how to do FaceTime. Or training the employee through a one-on-one meeting with social distancing, of course, or providing a simple page of instructions with pictures so even those with limited English skills can figure it out. A quote that I've always appreciated is, if you want to succeed, you should strike out on new paths rather than travel the worn paths of accepted success. That was by John D. Rockefeller. As noted, COVID-19 has dramatically affected our lives, from eating at restaurants to working out at a gym to attending movies, concerts, sporting events, and or religious services. And of course, it's affected people going to work, including yourselves. As a point of information, from February to the end of August, there were 4,423 COVID-related claims filed in Minnesota. As a rehabilitation professionals, you're aware that infected droplets are spread by a person's cough, sneeze, or talking out loud, which the virus may enter through your eyes, nose, or mouth. And within 2 to 14 days, the body's immune system is activated. The body may respond with the following symptoms: fever, a cough, shortness of breath, trouble breathing, fatigue, chills, sometimes with shaking, body aches, headache, sore throat, congestion or runny nose, loss of taste, loss of smell, nausea or vomiting, diarrhea. I even heard on the radio the other day that there's been a study and they found that COVID-19 has affected teenagers a little bit differently. that they're a little bit more irritable, that they suffer from depression, and they want to sleep in later during the day. Now, quite frankly, I don't know what the difference is between a teenager with COVID-19 and a normal teenager, but maybe the experts have already got that figured out. Other symptoms may include pink eye and rashes. And so with children, symptoms have included mouth sores and reddish purple spots on their fingers and toes. For those who are sick, they need to stay home. Make sure that they rest and stay hydrated. They should connect with a doctor, especially if having problems with breathing. And they should avoid public transportation such as buses and taxis. If living in shared space, such as kitchens, dining rooms, laundry rooms, bathrooms, there is the need to maintain social distancing as much as possible. They should not share dishes, drinking glasses, or cups, and the items used should be washed with dish soap and hot water. Areas that are common touch spaces, such as countertops, should be disinfected and cleaned frequently. COVID-19 causes fluid to collect in the lungs, which means there is less oxygen in the blood supply to the brain and other vital organs, which can cause them to shut down. Even for people who are asymptomatic, physicians are seeing lung inflammation, blood clotting leading to pulmonary embolism, and permanent lung damage. COVID-19 can lead to heart attacks due to inadequate blood flow. And there are neurological effects, including brain damage or injury. In addition to blood clots and stroke, the hypoxia caused by less blood flow to the brain may affect memory. There may also be psychological trauma, including post-intensive care syndrome, or PICS, due to malnutrition and cognitive impairment, resulting in decreased memory, ability to focus, and ability to solve problems. Chronic fatigue is also possible, as it was in SARS, the coronavirus that spread throughout the world in the early 2000s. In that case, chronic fatigue symptoms lasted 3.5 years after being diagnosed. Pandemics can be stressful, with normally healthy people affected the same as those that may be more fragile or thrown off their game because of a workers' compensation injury. This is seen as something more than a dark cloud with no sunshine in sight. Individuals may fear or worry about their own health and the health of the loved ones, their financial situation or job, or loss of support services that they rely on. They may have changes in sleep or eating patterns, have difficulty sleeping or concentrating, experiencing worsening chronic health problems. They may experience an increase of their use of tobacco or alcohol or other substances. The Department of Labor and Industries, DLI's mission is to ensure that Minnesota's work and living environments are equitable, healthy, and safe. The department serves employees, employers, and the public by regulating buildings and workplaces through education and enforcement. DLI's duties include assuring that workplaces are safe from injury and illness, buildings are safe and healthy for those who occupy them, workers injured on the job are provided treatment and benefits, that potential workers, and employers have a clear understanding of their rights and responsibilities in the workplace. As an FYI, a new law went into effect on April 8th, which stated that certain employees who contract COVID-19 are presumed to have an occupational disease covered by the Minnesota Workers' Compensation Law. Generally, these employees include first responders, healthcare workers, correctional workers, and those employees required to provide child care services for children of first responders and healthcare workers. It's important to note that injuries or occupational diseases that arise out of and in the course of employment are compensable under the Minnesota Workers' Compensation Act. For an injury to be compensable, it's sufficient that the employment is a substantial contributing factor to the condition or an aggravation or acceleration of a pre-existing condition. It's not necessary that the employment be the only cause of the condition. As with admitted cases, the department has also received several denials of liability from insurers. Example on the slide are some claim denials for COVID-19. The department returned to insurers saying, you need to provide more information or you need to accept the claim. Other examples are, we respectfully deny the employee is entitled to workers' compensation benefits. This does not provide facts or a legal basis to support that the work injury did not occur. Or that an employee was not credible. Again, does not provide facts or a legal basis. Or, in spite of repeated calls, the employee has not been available. If it is necessary to obtain information from the employee to investigate the claim, the denial should specifically state what information is needed from the employee, what attempts were made to obtain the information from the employee, and when the contact or contacts was attempted. Another statement that the injury was idiopathic. Well, this term is an acknowledgement that the injury occurred, but does not indicate why it was determined not to be work-related. That there was no witness. This may actually be a fact, but it does not provide a legal basis for denial. There is no requirement in the workers' compensation law that an injury be witnessed. It may well be compensable even if nobody witnessed it. Or the conditional denial. We have not obtained the medical records. Again, this does not provide facts or a legal basis to support that the work injury did not occur. It's important to note that a denial must be specific to convey clearly the basis for the denial in easy, readable, and understandable language to a person of average intelligence. So no fancy words. The insurer must attach a copy of a medical report or a summary of any healthcare provider contact that forms a basis for the denial. A denial must represent a real controversy and must not be frivolous or for the purpose of delay. Also note, DLI has been notified about employees with physical restrictions related to their workers' compensation injury who were told to apply for unemployment benefits when their employer temporarily or permanently shut down their business. Of course, you know this is wrong, and that employees may be entitled to workers' compensation benefits either monetarily or rehabilitation assistance to help them find new jobs. If you are aware of employees in this situation, encourage them to contact DLI's help desk at 651-284-5005, option 3. Again, let me repeat that number. 651-284-5005, option 3. Another instance where injured workers should be encouraged to contact DLI's help desk is if their employer tells them that they must sign a waiver in order to return to work. DLI has received information that some employers are requiring employees to sign a waiver agreeing that the employer is not liable if the employee contracts COVID-19 on the work premises. Other waivers state that employees who refuse to sign the waiver will be fired or unable to return to work. Others state that the employee agrees that by returning to work, that they have assumed the risk of contracting COVID-19, or that the employee is required to agree to mandatory arbitration. Such waivers may expose an employer to civil damages for obstructing employees from seeking workers' compensation benefits. That statute, as a point of information, is 176.82, subdivision 1. Also, asking or requiring an employee to sign a waiver may be viewed as discouraging employees from exercising their legal rights under labor standards or OSHA laws. Back to work. So where does that leave all of you? Well, your jobs have changed too. I've received several calls from QRCs telling me that the medical management services they typically provide have been reduced by half. There are injured workers needing to return to work, but many are scared that if they do so, they'll catch COVID-19 or carry the virus home to their families. That said, As you know, rehabilitation is intended to restore the injured worker to a job related to the employee's former employment or to a job in another work area, which produces an economic status as close as possible to that which the employee would have enjoyed without injury or disability. Rehabilitation to a job with a higher economic status than would have occurred without disability is permitted if it can be demonstrated that the rehabilitation is necessary to increase the likelihood of reemployment. Let's get people back to work. Economic status is to be measured not only by opportunity for immediate income, but also by opportunity for future income. As such, you still have a job to do. According to the American Staffing Association, there are more than 3/4 of the employed U.S. adults are satisfied with their employer's pandemic-related return-to-work plans. Unfortunately, 7% reported that nothing would make them feel safer, and it's those 7% that are going to give you a challenge. If you have an employee refusing to work, I suggest that you provide them with the department's help desk number, again, 651-284-5005, option 3, so they can review the pros and cons of their decision, which may affect their TDD benefits, and so that you're not put in the position about talking about money. Okay, now the fun part of all this is that when we start talking about the different generations that you're likely going to be working with, well, those except the Gen Alpha group, which is for the years 2010 to 2024, or those that are currently 10 years of age. Baby boomers who grew up saying, be cool, and millennials, known as Gen Y, those born between 1980 and 1994, are generally satisfied with their employer's return to work plans. Their satisfaction is interesting considering that baby boomers are thought to be hardworking and millennials not so much. And then there's Gen X, those that were born between 1965 and 1979, and Gen Z, those born between 1995 and 2009, who were just less satisfied. Since creating the PowerPoint slides about the claims here in Minnesota, they've changed. And they've changed from July to as late as the end of August. Four of the most notable areas were manufacturing, which you see here was at 60. At the end of August, was 974. And for healthcare assistance, you see here that it was 1,810, is now jumped up to 2,736. Public administration, which was at 183, has doubled to 365. Administrative support was 102 and is now at 110, so not so much, but interesting just the same. Now that said, the occupations with the most COVID filed claims since July have been in the areas of healthcare support, professional, and production. So maybe not a surprise there. In healthcare support, back in July, it was 750 and is now 1,109. Healthcare practitioners and technical occupations was 583, is now 926. Production occupations was 34, has jumped up now to a whopping 642. Protective support, again, one of these doubling situations where it was 157 in July, now 305 at the end of August. Building grounds and cleaning was 169 to now 214. So quite interesting on how those jumps have been. One of the interesting other parts, and this is something that you're probably going to see as you get more referrals, is that the ranking of occupations with the highest claims to the lowest, where the first highest was nursing assistants. Most of the folks that end up working the hardest because they're doing all the lifting and literally of patients. This was followed by registered nurses, then food processing, personal care aides, psychiatric aides, meat and fish cutters, licensed practical nurses, LPNs, janitorial and cleaners, except maids and housekeeping cleaners, health support workers, home health aides, correctional officers and jailers, think about that confined space, medical and health service managers. Now, as security season vendors, you do what you do best, which is to facilitate communication with injured workers. In the past, there was a lot of face-to-face meetings because there's so much more that you can learn from a person's body language, both in what they are saying and what they're not saying. With that, you've had to be more creative as far as your use of social media, other than texting, of course, such as Zoom, to communicate with your clients to see how they're progressing and what's happened at their medical appointments. Perhaps you've been a little more organized, such as writing bullet points to make sure that you're covering all the information that needs to be covered. And perhaps due to your clients' worries, you've let them vent a little bit more, yet you've also set boundaries on the length of conversations. You know, for instance, saying, well, I'm expecting a call in another 10 minutes, so we can talk until then. And now, as the slide indicates, some restrictions are being lifted, so you need to figure out social distancing both in and out of doors when meeting with clients. While you don't have enforcement authority like OSHA has, it's important that you see where your employees are returning back to, and that they're able to do that safely, because that's your job, to see that they return back to work in a safe and suitable environment. Now, employers are tasked with needing to look at what job tasks may facilitate their employees' exposure. This includes proximity from other employees and the outside public. For instance, individuals working at a grocery store may be exposed to both. Now, employees and employers are always interested in a 30-second preventative measure, as you know, primarily because it's quick and it allows them to get on with their work. Unfortunately, not all these are effective. As you can probably see with this can off that he's spraying himself with, it's probably not going to kill the COVID virus. But I kind of give him credit for trying. There were folks who thought that the best way of heading off COVID-19 was to purchase 144 rolls of toilet paper for a 14-day quarantine. If they really truly believe that 144 rolls was necessary, then maybe they should see a doctor long before the virus ever came out. That said, we need to know that nothing beats old-fashioned hand washing. As such, clients should be reminded to wash their hands for 20 seconds or more, or know that, just wetting them and drying them doesn't meet the grade. Ask them if their employer has hand sanitizer that's out for use and encourage them to use it. Yes, their skin may dry out, but, they can always put lotion on it when they get home. Ask them if their employer cleans high traffic areas, and if doing an on-site analysis, take a look and see what's being done there. If not, then your client needs to even be more mindful of taking precautions. Social distancing. It's a popular term right now. We're told that besides wearing a mask, we should have 6 foot of distance between ourselves and the next person. And unfortunately, from what I've seen, except for in stores where it's marked out on the floor, most people have no understanding what 6 foot is, because you usually see them standing or sitting, quite frankly, 4 feet or less from one another. So for city folks, the average distance to keep in mind is about 2 shopping carts placed end to end. For rural folks, I've heard it's the length of a cow, give or take. Maybe somebody can check that out for me. Okay, back to business. If possible, get a sense if the employer has marked off space 6 feet apart for the employees and for the customers. See if the barriers have been placed to contain the spread of the cough, and determine if the employer has put up reminder signs for everybody about social distancing. Ask employees when entering an employer's building to look to see if everyone is wearing a mask. I went to a bar recently to meet with some friends. The bar posted a sign on the door that everyone had to enter with a mask on. However, once in the building, everyone took their masks off and were sitting or standing elbow to elbow. Really. There's a cute saying on the internet right now that goes, it's okay to wear a life jacket, bike helmet, sunscreen, earplugs, sunglasses, or a seatbelt when it protects us. However, when asked to wear a mask to protect others, it's an outrage. Why are we making things so difficult? I went to a health clinic recently for some lab work. And before I could enter, there was a person at the entry who asked me a list of questions, some of which included, have you or anyone in your household had any of the following symptoms in the last 21 days? Sore throat, cough, chills, body aches for unknown reasons, shortness of breath for unknown reasons, loss of smell, loss of taste, fever or of at or greater than 100 degrees Fahrenheit. Have you or anyone in your household been tested for COVID-19? Have you or anyone in your household visited or received treatment in a hospital, nursing home, long-term care, or other healthcare facility in the past 30 days? Have you or anyone in your household traveled outside of the United States in the past 21 days? Have you or anyone in your household traveled on a cruise ship in the last 21 days? I don't think there's a lot of cruise ship things going on right now, but the question does come out. Are you or anyone in your household or a healthcare provider or an emergency responder? Thinking about exposure, right? Have you or anyone in your household cared for an individual who is in quarantine or is a presumptive positive or has tested positive for COVID-19? Do you have any reason to believe you or anyone in your household has been exposed to or acquired COVID-19? To the best of your knowledge, have you been in close proximity to anybody who has tested positive to COVID-19? Employers should be asking the same questions of their employees or customers when entering their building. Employers should have protocols set up. Also, if someone should become ill at their workplace, as listed on the slide that you're looking at. Now, whether your client becomes sick with COVID-19 or not, if they have to go into isolation, they're going to worry. If they go into isolation, be sure to call them weekly, if not twice a week, to find out how they're doing and letting them know that there's somebody out there that's concerned about them. If your client was diagnosed with COVID-19 prior to referral or while you've been working with them, be aware of the requirements for a safe return to work. According to the current CDC guidelines, the employee has to be fever-free for 24 hours without medication. There needs to be improvement in symptoms, not just respiratory symptoms. If they've had severe illness, that the duration of the isolation was at least 20 days after the onset of symptoms. And for those that never had symptoms, isolation can be discontinued after 10 days from a positive test. I hope you enjoy The Angry Cat, not to be confused with the Angry Birds video game. Most people don't think about the spread of a cough or sneeze. Generally, a sneeze is colorless and seems to dissipate quickly. So as a reference point for those confused about the spread, and when you're explaining it to people, what you should do is say, listen, think about the smell of burnt popcorn, which seems to go everywhere. And that will help people think about where is it that this virus can go with a cough or a sneeze. Controls are important, and to provide a margin of safety without otherwise that won't be there. A recent Harvard study demonstrated how without a mask, a cough will spread out from under the plastic screen into a surrounding area. That said, measures of limiting break room capacity, which most people don't think about, is really important. Replacing in-person meetings with video conferencing or a cell or computer go a long way. An expert was recently asked about the spread of COVID-19 through mosquito bites, of biting an infected person and then biting a healthy person, especially here in Minnesota. Well, it's a good question, and the fact is that in September we still have mosquitoes. The answer is no. COVID-19 is an airborne, not blood-borne disease. Hence, that's why wearing a mask is so important. A mask doesn't protect the wearer. It protects others around them. This slide illustrates. And of course, the most important part of the employer's return to work plan is training the employees how to put on and take off their clean personal protection equipment, which you probably heard on the news referred to as PPE, plus proper cleaning of the work areas and understanding the limitations of PPE. I'll give you a moment here to read the rest of the slide. Okay. If you've been in stores and other business locations, this picture is probably no surprise to you. There are people who don't cover their mouth or their nose or leave their nose exposed, forgetting that the virus could enter their system through their nose. Nor should people touch their face masks, as they may contaminate their clean hands. Interesting. If it appears that an employer is retaliating against workers or having them work in an unsafe work environment, encourage them to contact DLI's help desk. Remember, that number is 651-284-5005, option 3, and have them review their situation. Their call can then be directed to the most appropriate person to deal with that situation. Workplace safety is everybody's concern and duty. At the Minneapolis VA hospital, staff refer to going into a wing in which there's COVID patients as going into the hot zone. This is a real fear about bringing home the virus. Did you know that the virus can live on clothing for a couple of hours to a day? So if you're throwing infected clothes into a hamper, a good precaution is to clean and disinfect the hamper frequently, or just to skip the hamper altogether and put the clothes directly into the washing machine, and then go shower. When washing clothes, folks may want to throw in some Lysol in addition to their regular laundry detergent. As professionals, we know that everyone reacts differently to stressful situations. Those who are at higher risk for severe illness due to being older, or people of any age with certain underlying medical conditions, whether they're older or the children or the teens, it's all going to be there. People caring for family members or loved ones are at risk. Frontline workers such as healthcare providers and first responders, as we discussed, essential workers working in the food industry. They think of the meatpacking plants, people who have existing mental health conditions, people who use substances or have a substance use disorder, people who have lost their jobs, had their work hours reduced, or have had other major changes to their employment. And stressful situations for people who have disabilities or developmental delay, people who are socially isolated from others, including those who are living alone or live in rural environments, people in some racial and ethnic minority groups, people who do not have access to information in their primary language, people experiencing homelessness, people who live in congregate or group settings. We've gone through a lot of information today about COVID-19, so stop for a moment to take a breath. Remember to do this each day as you work through the pandemic. Now, right now, your billable may not be great. You may be wondering what your role in the workers' compensation will be. Breathe. Most people out there have no clue what you do, yet you make a difference in people's lives, that of the injured workers and, quite frankly, the employers. So breathe. Set realistic goals and make a plan each day so you can stay on track. The day will come and that will be less overwhelming, and you'll be able to confirm your forward progress. Just breathe. Again, take care of yourself. Take care to exercise, get enough sleep, and eat healthy meals, which of course means limiting junk food, and take a break from social media, especially if there's politics or topics that you find stressful. Connect with people who are important in your life. And remember that they need to hear from you as much as you need to hear from them. Remember that life is 10% about what happens to you and 90% how you react to it. And that's the end of today's presentation. Thank you. If you have any questions, please send me an email at mike.hill@state.mn.gov. state.mn.us. Again, mike.hill@state.mn.us. Stay healthy out there. Take care. Bye.